So, Mr. Bear, what I was thinking of doing for the next treatment is I was thinking of doing some craniosacral therapy. And what craniosacral therapy involves is just working with the bones of your skull and also of your spine. And in your skull, there's the brain, and around the brain, there's a fluid that protects everything, and that same fluid actually goes down your spine as well. And just like your circulatory system, your spinal fluid, your cerebrospinal fluid, which is what this fluid is called, has a rhythm. And so what this therapy does, and what I would like to do with you next treatment, is work with that rhythm to sort of realign your body, because what happens is that sometimes our body gets tied up into knots, kind of like a telephone wire that just gets all curled up together. What we want to do is try to lengthen that and to get rid of the kinks and the curls and just stretch it out. But this is a very subtle modality. What I use is a pressure that's very, very light. And so it may feel like we're not really doing much, but you'll notice at the end of the treatment that there's some significant changes that you may or may not feel in your body, and but the modality is actually quite light. So what I'm going to be doing, the majority of the treatment will be spent working on your head with a very, very light pressure. And what this does is that your skull is actually made up of several bones. And it works with these bones to realign them if they're out of alignment. So this is what I was thinking for the next treatment, and you can let me know if this is something that interests you or not. Here I have a brochure that you can look at, and it's got more information along with a website that you can check out if you're interested. And yeah, we'll see you next treatment.